management of chronic conditions is changing, I think, beyond all recognition. I think if one just looks back a few months where we have practitioners and doctors and nurses working very well, but working in a fairly disparate way. Whereas with the chronic conditions management project, the way that people are being brought together and the focus on delivering a joined up care and service to the patients and their families is really having a dramatic impact on how we deliver our services. You'd expect me to say that my focus is on Cardiff and the Vale, and it is, and the benefits will be significant for our area, but they go much wider than that, and I'm really pleased that Cardiff and the Vale have been chosen as one of the pilot sites to take the demonstrator forward, to draw out the learning and start influencing the way we work, and that we can share that across the whole of Wales, because one of the key drivers with the reorganisation of health in Wales is about getting us to work closer together and to support each other and get the most for the people of Wales.
Since the directive was launched in March, we've been working with the Cardiff Demonstrator team, and they've been helping us to map our current service provision and also to work with the results-based accountability. And that's helping us to work with a wide range of partners which we wouldn't necessarily have worked with before. And our aim through that is to initiate care management plans for people with epilepsy within primary care, within the community, so that they don't have to travel to a secondary care service. It's difficult for people with epilepsy to travel to a secondary care service if they have active epilepsy, and because they can't drive, and it can sometimes be difficult for family members to bring them. So having local primary care based services is excellent for people with epilepsy and for their families. The most enjoyable thing about working with the Demonstrator project is that they've helped us to focus on the outcomes, not the progress of making changes. I don't think we would have done that without the help of the Demonstrator team. They've enabled us to all get together, put forward our ideas at our very low cost. It's helped us to look at why people don't attend their first case, possibly first seizure or first blackout appointments. And we've identified that it may possibly be due to the fact that the epilepsy unit has the name epilepsy within the title, and that can be quite stigmatising for a person who doesn't yet have a diagnosis of epilepsy, and also it can be quite frightening to think they may be diagnosed with such a chronic condition at their very first appointment. So the Demonstrator team has helped us to look at the reasons why people may DNA their appointments, and alongside this we are considering changing the name of the epilepsy unit to something else which doesn't necessarily have epilepsy within the title of the department. Patients with epilepsy will benefit from these changes, and in turn we hope their epilepsy would improve.
Neighbourhood Management is Cardiff LSB's Transforming Neighbourhoods initiative. It's working across Cardiff with 6 virtual teams to problem solve localised issues with a localised solution. The demonstrator has shown the need to push the boundaries and try and test new initiatives. All agencies have a part to play in the management of chronic conditions. It affects everybody, and all agencies will be part of the solution for that. It's not one agency working independently, it's everybody working together to tackle the issue. It's not rocket science, it's about working together as Team Cardiff.
Currently, diabetes patients are managed in one of 2 areas, either in primary care, usually by their general practitioner, practice nurse and other practice staff, or in secondary care by a multidisciplinary diabetes team. And the core components of that team would be diabetologist, diabetes specialist nurse and dietitian. One of the difficulties with this model of care is that primary care and secondary care are geographically quite distinct and separate from each other, and that leads often to difficulties in communicating, and really the opportunities for a true shared care protocol are very limited. So what we hope to be able to demonstrate is that a community diabetes model whereby the multidisciplinary diabetes team from secondary care moves into the community at least some of the time would address some of these issues. And we envisage that we would be able to provide a high quality clinical service that's in partnership with our primary care colleagues, true multidisciplinary working at a location that's convenient for patients closer to their homes. and we feel that this would be more acceptable to patients. They would find it easier to access the service, and also that we would be able to enable them to develop the skills that are necessary to manage their diabetes with more confidence, so that they become empowered to take control of their diabetes for the future.
We are hoping that the pilot, which at the moment is going to be in one specific locality, would be rolled out if successful across Cardiff and the Vale, and indeed the whole of Wales. We are hoping then to deliver the diabetes management of patients closer to their home under shared care principles. This in turn will reduce the referral rate to secondary care for hospital-based treatment. Furthermore, we are hoping that if this is successful in diabetes, that this could translate to any other chronic disease where multidisciplinary team working is seen as a core component. I think it's very exciting to be part of a change in practice that's going to be whole scale and could have real advantages for both patients and healthcare professionals.
Vulnerable groups traditionally find it very difficult to access health services, and in the locality that we're looking at piloting the community model, we have the prison, we have homeless people, people who have poor mobility and are housebound, a lot of black and minority ethnic communities, and people with long-term mental health conditions. This new community model is going to allow us to bespoke services to the individual needs of each of these communities, and so make them more accessible, delivering the service to the patient. It's really exciting to be involved in this new diabetes model in the community, because it's the way we want to take diabetes services forward. We want to promote education of the person with diabetes to allow them to manage their own condition and live a long and happy life with diabetes.
The Demonstrator project is really very critical to us. We, for the last year and a half or so, have developed proposals for a community-based diabetes model that centres around multidisciplinary working and working in partnership with primary care. And we're aware that these models can work effectively in other parts of the UK, but of course at the moment these are ideas, and what the Demonstrator site allows us to do is put those ideas into practice, a proof of concept if you like. And we're very confident that we will be able to demonstrate that it's acceptable and indeed preferable to patients and professionals, and also patients, carers and families. So really, without the Demonstrator site, we couldn't implement this community model. It's essential to us.
The number one benefit that the Demonstrator has brought is better quality care and service to the patient and to their families. That's without doubt. The other key benefits that have come in as well are much greater working together between agencies, breaking down the silos and the bureaucracies that have existed in the past, forcing us to work much more closely together. There's an obvious benefit in terms of reduced cost for the health service, and that's not just about saving money, but with that reduced cost that enables us to expand and give more services to more people. So all in all, it really is driving a new way of thinking in both health service delivery and in joining up with local authorities and other partners. If I had to summarise a key message from the Demonstrator project, I would say it is about delivering services where they should be delivered, at the right time, the right place, by the right people.